All right, admitting you have a problem is the first step to solving it, but what if you don't know how big that problem is?
We know we are in the middle of an opioid crisis, but TV 11's Rolly Hoyt tells us Arkansas is trying to fill a troubling data gap.
Greg and Marlisa, we are going to use a couple of maps to try and illustrate this problem. The CDC has this map. It shows how bad our prescription rate is. We're second in the country, but you notice our bright red color there matches our neighbors. But then there's this map. This tracks opioid deaths. All our neighbors are still bright red, but we're just average. It just doesn't make any sense. State officials say it's because we have a huge data problem.
Start with a basic question. How many people died last year from a drug overdose?
I would like to tell you how many people we lost in 2018, but those numbers aren't available to us yet. And that bothered us, and it bothered all our working partners.
That's because Arkansas is among the worst in the country when it comes to reporting when somebody dies.
There's been no consistent method or manner of doing medical legal death investigation.
There's 75 different coroners, 75 different reporting systems, 75 ways to report. So there's no uniformed reporting system.
That's brought people like Saline County Coroner Kevin Cleghorn together with Drug Director Kirk Lane to try and fix it. They, along with a handful of other partners, won a grant that's going to build a better database.
We want to make good decisions, and we want to make it on the basis of data, not emotions.
That's easier said than done. The effort gets a boost from a high-tech reporting system called the MDI log. It allows coroners to quickly input death information, but not all coroners are on board.
The coroner mentioned how there's resistance in some pockets. What do you attribute that resistance to?
Whether it be state government or county government or city government, there's always that resistance to change.
Cleghorn, as head of the State Coroners Association, plans a full-court press.
A lot of the coroners, and I can understand the mindset, it's not been broke, let's don't fix it. But it is broke, we need to fix this, and this is the way to do it.
Now, if the database gets better, there are some benefits. It can help law enforcement spot outbreaks where a bad batch of drugs could be getting out onto the street. And when it comes to getting grant money, you're actually judged on your data, so better data means a better chance at more funding, and that means more tools that could help us solve this crisis.